Welcome to this video presentation about vasectomy, a safe, gentle, and highly effective method of contraception. I'm Dr. John Curington, a physician who's been doing vasectomies for over 20 years. I've done vasectomies for many thousands of patients, trained other physicians, and even had a vasectomy myself. This presentation will cover several topics. First of all, exactly what is a vasectomy? What are the details of the anatomy? Exactly how is a vasectomy done? What are the alternatives to a vasectomy? What are the risks? And what are the benefits? To make things more clear as we go along, I'll be sketching up a few diagrams to illustrate exactly what we're talking about. So first of all, what is a vasectomy? A vasectomy is a simple, safe, effective form of birth control for men. In order to understand a vasectomy, we have to understand the anatomy. We'll start with some basic diagrams. First, I just sketched a penis and a scrotum. For these illustrations, I lifted up the penis to show the scrotum more clearly. Inside the scrotum are the testes. We say one testis, and the plural is two testes. You can also say testicles or balls. All these terms are okay. Sperm, the small swimmers that can cause a pregnancy, are made in the testes. Each testis has a small tube that carries the sperm up into the body. The small tube is called a vas deferens. The plural of vas is vasa. There are two vasa, one for each of the testes. The whole point of a vasectomy is to divide each vas deferens. With the vasa divided or snipped, sperm can't travel up to the body, and the man is safe from causing a pregnancy. Let's see how this works in more detail. I've rotated these drawings. Now we're looking from the side into the man's body. We have the penis, the scrotum, the testes, the bladder, and the prostate. Let's look at what each part does in detail. First, when you urinate, you empty urine from the bladder through the penis. You can see that peeing doesn't involve the scrotum at all. When you ejaculate, the vast majority of fluid comes from the prostate and the seminal vesicles. Only about 2 to 3% of the total volume of the ejaculate comes from the testes. How does this work? Each testis is connected to the prostate by a tiny tube called the vas deferens. As we said, most of the fluid for ejaculation is made by the prostate and seminal vesicles. Only a tiny fraction is made by the testes. The whole point of a vasectomy is to divide the vasa. The prostate and seminal vesicles still continue to make fluid. The testes continue to make sperm, and the sperm are just reabsorbed by the body. Thus, you continue to ejaculate normally, but the fluid has no sperm. We say all the juice but no seeds. As you can see, the vasectomy is done well below the prostate and the penis. Because a vasectomy doesn't even get near the plumbing of the penis, there's no way to change erections, sexual functioning, or sensation to the penis. After a vasectomy, we say snipped but still equipped. So exactly how is a vasectomy done? Before your vasectomy, the most important thing is to be sure that you have the number of children you want. Vasectomy should be considered a permanent procedure. I'll say this again. Vasectomy should be considered a permanent procedure. There is a procedure called vasectomy reversal, but a reversal doesn't always work. A reversal is an expensive procedure and a time-consuming procedure and is not guaranteed to work. In short, if you're planning on having a vasectomy, you should think of vasectomy as permanent. That being said, how do we do the vasectomy? There are basically 3 steps: anesthesia, or numbing the area, then accessing the vasa so we can work on them, and then dividing the vasa. The anesthesia, or numbing, is done using either a sprayer or a tiny microinjector. The sprayer is called a MetaJet and uses a puff of air to push the local anesthetic into the skin and the vasa. Most men say this is surprisingly gentle. Many guys say it feels like a quick snap with a rubber band and not much more. The microinjector, on the other hand, uses a tiny injection device. The part that enters the skin is super thin, and most men feel that they barely perceive the injection. Some practices use the MetaJet and some practices use a microinjector. I myself feel that they both work very well. After numbing, we access the vasa through a tiny puncture in the front wall of the scrotum. Back in the old days, we used to make 2 incisions, one on each side of the scrotum. Making 2 big incisions was associated with more complications, so now I don't even have a scalpel anywhere on my tray. In the modern no-scalpel technique, we use our fingertips to gently find the vasa. Using our fingertips, we gently manipulate the vasa to bring them to the front of the scrotum, and we make a tiny puncture in the middle just over the vasa. After making the tiny puncture, we gently pull a small section of the vas outside of the scrotum, where we snip, cauterize, and fix the 2 snipped ends apart. For keeping the ends apart, we can either use a tiny metal clip or a tiny piece of suture. Both the clip and the suture work great. We make sure we address both vasa, and when we're done, the little puncture site is usually so small you don't even need a little stitch. The little opening just heals on its own. After the vasectomy, it's important that you lay around for the rest of the day. Even though the procedure is minor, if you really shake things around, you can increase the odds of getting significant bruising or swelling. Spend the rest of the day in bed, on the couch, or in a recliner. It's okay to get up to go to the kitchen or the bathroom, but for the most part, just lay around. The next day should be a peaceful day of gentle walks. Get up and walk around the block or walk in a park, but just take it easy. The day after that, most men return back to work. So now that we've covered what is a vasectomy and how is it done, let's talk about alternatives to vasectomy. What are the alternatives to a vasectomy? I myself am a firm believer in vasectomy. I've had one myself and I've been super happy. Still, it's important to understand that there are many other methods of birth control out there. Other options include tubal ligation, IUDs, implants, injections, pills, patches, vaginal ring, condoms, fertility awareness, diaphragms, contraceptive sponges, withdrawal, spermicides, and abstinence. That's a lot of methods. For men, the alternatives that we can use ourselves are abstinence, and that means not having sex, withdrawal, and condoms. Not many of us would be too excited about not having sex, so that leaves the male methods as withdrawal and condoms. Condoms do have the benefit of reducing sexually transmitted infections, though many men are looking for a method that gives them more spontaneity and freedom with their established partner. For more information on the male methods, do an online search for CDC contraception, and you'll find great information. Here's an example of a chart from contraceptivetechnology.org. The CDC references this chart, and it's full of useful information. It's worthwhile to do an online search for the CDC contraceptive information and follow their links to the charts. The big point is that there are many alternatives to vasectomy, and it's important to consider them all before choosing. Changing topics now, what are the risks of a vasectomy? It's important to remember that the vast majority of men have no complications at all from their vasectomies. Like any other minor surgery, though, getting a vasectomy has risks. Even driving a car has risks, but the benefits of getting from point A to point B so outweigh the risks that we generally continue to drive. So what are the risks of a vasectomy? You can group the risks into two clusters, short-term risks and long-term risks. The short-term risks include bleeding problems, anesthetic reaction, pain, infection, bruising, and bleeding into the scrotum, causing a collection of blood called a hematoma. The long-term risks include the development of a lump of scar tissue, chronic pain, and continuing ability to cause a pregnancy, as well as other potentially unknown risks. To put these risks into perspective though, most of us drive a car every day. In the US alone, over 30,000 people die in car accidents every year. I know of exactly 0 deaths from vasectomy. Every year, car accidents cause all sorts of injuries, leading to chronic pain, time off work, etc. Yet we drive around comfortably all day. There is far less risk involved in a vasectomy than in driving a car. Looking carefully at the real statistics, I am very comfortable recommending vasectomy for my patients who choose that as their method of contraception. As experienced physicians, we do everything we can to minimize these risks. We read, we practice, we go to conferences, we teach other physicians. We are dedicated to doing everything we can to make sure your procedure goes well. Remember, vasectomy is a very gentle procedure and complications are very rare. Please read more on our website and do ask any questions. Another very important point about risk is that there are risks to not having a vasectomy. For example, if your wife or girlfriend continues to use the pill or any other form of contraception, she has to take on all those risks. For example, birth control pills lead to a slightly increased risk of blood clots, high blood pressure, mood changes, and so on. Also, if she has another child, she has to take on all the risks of childbirth also. By having a vasectomy, you are taking a very positive step in decreasing these risks for her. For many, many years of our lives, we men get to enjoy the pleasure of sex without so much of the responsibility. To be fair, it's time that we man up and take some of the responsibility too. I've had a vasectomy myself, and I've done many thousands of procedures. I believe the benefits of vasectomy far, far outweigh the risks. So what are the benefits of a vasectomy? As a physician who's had a vasectomy and who's done many thousands of vasectomies, I can tell you that I don't have to worry about pregnancy. We can have great spontaneous sex and not have to worry. I feel good about taking control myself and being responsible. It's good for me, good for my better half, and good for our family. This has been Dr. John Curington, a proud member of the Snipped But Still Equipped Club.